One of my favorite places, Provincetown, made national headlines for all the wrong reasons last month when COVID cases spiked in the days and weeks after the 4th of July, including among the vaccinated, thanks in large part to the extremely infectious Delta variant.
No vaccine is 100% effective. And so you can expect breakthrough infections. We've already seen that from the experience in Massachusetts, in Provincetown.
There were 346 confirmed cases of COVID-19 in people who were fully vaccinated. This new finding, combined with data from other outbreak investigations and surveillance studies across the country, was critical in our decision to update our guidance for those who are fully vaccinated.
That updated guidance, of course, recommends that fully vaccinated individuals living in COVID hotspots continue to mask indoors after studies about the Delta variant show that the vaccinated can carry just as much of the virus in their bodies as the unvaccinated. But the CDC director says the P-Town outbreak isn't all bad news.
In all of this, there is still good news. Our vaccines are working to prevent severe illness, hospitalizations, and death.
And now progress is being made. Town manager Alex Morse joins me. Alex, good to see you again. Thanks for being here.
Of course. Good to see you too, Jim.
When I spoke to you a few weeks ago, things were getting worse. In the last few days, you said, quote, we're well on our way to containment. What's that mean?
Yes, and that's certainly the case here in Provincetown. We peaked at over 15% positivity rate on July 15th, and now our 5-day average is under 5% at 4.7. We dipped down to 3.3 as of last Friday, and right now we only have 56 active cases in Provincetown. And so that's certainly good news, and like I said, on our way to containment.
What'd you do to get there?
A few things. I think, number one, we recognize that there would be a spike for 3 to 4 weeks following the first 2 weeks of July, and the incubation period itself and the recovery period, that time was on our side, given what we knew. Number two, I think both the advisory and the indoor mask mandate over the last 2 weeks has also helped. That I've been confident in saying that in the long term, this is really about vaccination, our way out of this. But when you have a spike like we saw in Provincetown, indoor masking in the interim is going to help as well. And the last thing I would say is, as the CDC has said, I think this is a positive story in many ways, that absent the vaccine, this would have been an incredibly different, dangerous situation, that we haven't seen severe illness, a spike in hospitalizations, and we've seen 0 deaths out of nearly 1,000 cases related to the cluster. And I think it's a testament to our community in that we are a very public health, public conscious community that took contact tracing seriously and testing seriously and got a hold of this as soon as we could.
I want to return to what Dr. Walensky said in a second, but you said your community took it seriously, but a ton of the people, the vast majority of people who were in town during this, were not residents of the town. There were people coming to Provincetown. Were they mostly respectful of the restrictions you put in place, unlike some of these horror stories we've heard from other parts of the country?
Yes, I think, number one, the reason that we've emerged from this, I think, stronger and safer is because we're one of the most vaccinated communities in the state and in the country. And for the most part, most of our visitors are vaccinated as well. And so it would have been a different situation. The first 2 weeks of July, we had no industry restrictions. We were following CDC guidance. And so, visitors or residents, no matter what folks were doing, it was in accordance with the guidance. And since we enacted an indoor mask mandate and public health advisory, for the most part, there's been compliance. And we appreciate that. And we want people to know that they can come here, but bring a mask, please be vaccinated, get tested if you don't feel well. But to fully enjoy the Provincetown experience, you need to be vaccinated.
Speaking of needing to be vaccinated, I'm sure you know that the guy who runs a city a little bit bigger than your place, New York City today, Mayor de Blasio, said you must be vaccinated to enter an indoor dining facility, a concert, a gym, those sort of things. Are you contemplating those kinds of things? And if you're not, why don't they make sense everywhere?
Well, I think in the long term, it does make sense. What I would say to that is Provincetown can't do this on its own. So even though we have one of the highest vaccination rates and some businesses are doing this, what we see here is that some of the biggest drivers to get people to be vaccinated are decisions that need to be made on the federal level. I mean, we looked at data over the weekend that said if it was required to fly, that you need to be vaccinated to fly, 40 people would be 40% more likely to get the vaccine, as opposed to 10% more likely if they got $100. And so Provincetown can't do this alone. I will say locally, we are exploring a program with the Board of Health for two things. That businesses can get a certification from our Board of Health if they've required 100% of their staff members to be vaccinated, and then they can get another certificate from the Board of Health if they are requiring vaccination for any patron or customer that goes into their business, and they can put that on display because there are residents and visitors that are interested. What businesses are requiring it for their staff? What businesses are requiring it for the public?
How has this affected business? It's obviously the most critical time of the year for Commercial Street and beyond.
Yeah, no, it's been a challenge the last couple of weeks, to be honest. I will say June was, I think, the best June that many of our businesses here in town had ever, which was a really great sign of a comeback. The last 2 weeks of July, I think, were a little bit of a challenge. I mean, they're slower than the first 2 weeks of July historically anyway, but they've definitely seen a bit of a downturn, and we're hoping to see a rebound here in August. And really telling people, keep coming to Provincetown, but again, be safe. You can have fun here. You can leave safe. And I think with the numbers declining so sharply, I think that message is starting to get out.
Could you flesh out for a minute what you touched upon and I touched upon? Dr. Walensky saying that the moral of the Provincetown story is that vaccinations work. What explicitly did she mean?
That when you look at our cases, and people saw this number of 900 or so cases related to the Provincetown cluster, and to think not a single death, only 7 hospitalizations, and of those who tested positive, incredibly moderate and mild symptoms, who are now in recovery, and the fact that we now only have 56 active cases, this would have been a completely different situation if not for these vaccines. And I think in the long term, this is really about mentally adjusting to the fact that we're entering a new normal of having to live with the virus, manage the virus, and mitigate its impact. And so that's going to be incredibly useful moving forward.
Alex, when I spoke to you a few weeks ago and things weren't so good, you looked incredibly calm. 3 weeks later, you look incredibly calm. Is that who you are, or what's the deal?
I would say that that's who I am. It's always been who I am. I think my experience over the years has certainly helped. Things come and go, and particularly as a policy and public official here in town, I think it's important to stay calm and to be confident and follow the data and science and surround yourself with good people. And I've been grateful to have folks here in Provincetown to develop relationships with Barnstable County, our state delegation, our Board of Health, our select board. Everyone's just been working together with public health and public safety in mind. And so lucky to have a great team here, a great community, and thankful to be here and thankful that we're on the mend.
I wish I could borrow some of that calm. I'll see you there in Provincetown in 3 weeks. I'm looking forward to it. Alex, thanks so much for your time.
Thanks, Jim.
Thank you.